Goeienaand, good evening, fellow South Africans and citizens of the world. Now, there's a very disturbing trend developing in South Africa. We know about St. Augustine's Hospital in Durban, where over 60 staff and patients in this private hospital were confirmed positive with the coronavirus. That's how quickly this thing just spreads out. We know in the public health system, there are a couple of hospitals where coronavirus has been detected. The difference between the public health system and the private health system is that many public hospitals do not have testing kits available, even though what the ANC is saying. I've got many reports about that. And people who feel like they've got it have just been sent home to self-isolate without being checked. So that puts a huge question over the exact number of people that are infected with the coronavirus. And more disturbingly, if you consider how conditions are for the populations in the townships where they literally live cheek to jowl, it's like that hospital. It's just going to spread right through the community. And as I've suggested, I think that's probably happening right now during this sort of asymptomatic period where all of a sudden there's going to be a huge issue with areas in townships where it just suddenly becomes apparent. And to give you an example of getting out of the hospital system, let's look at the prison system. Now, I was speaking to Marius Venter earlier this evening on this channel, the main Loving Life channel, about how in Plettenberg Bay they're dealing with the coronavirus and they're doing a fantastic job. Now, what they've done at Plet is they've got this chemical which has been used successfully in China and Singapore and other places and sprayed it right through the town and through the taxis and anywhere which is high risk with the coronavirus to minimize the impact of that virus. They have been approached to do the same thing in the hospital system, not the hospital system, the prison systems in the Eastern Cape and going down the coast. And in East London, for example, there's been a cluster of coronavirus cases that have appeared in the last couple of days. And that's risen to 53 in just one correctional centre in East London. I'll add a bit more meat to the bone. The number of prisoners that tested positive for COVID-19 has risen by 49 cases following an outbreak at the East London Correctional Centre, the National Corrections Services Department has confirmed. In a statement on Tuesday, the Department of Correctional Services, or DCS, said the rise brought the total number of inmate cases to 53, while 23 officials had also tested positive for the virus at that prison. That's 76 infected people through one original infection in this enclosed prison. Think about this in a township, what it's going to do, especially if it's not actually, they're not tested and it's not verified, it's just going to go. St. Albans Correctional Centre in Port Elizabeth also had its first confirmed case after an official tested positive, while another official at the DCS head office in Tshwane has also been infected. Now, while we're talking about that, there are a number of police who've also been confirmed as infected with the coronavirus now. And in fact, Douglasdale Police Station was shut down so they could decontaminate the place, and I think a few police at that station were infected with the coronavirus. So you can see it's kind of starting to spread. Anyway, DCS spokesperson Singabako Nluximalo told News 24 that contact tracing has been done with regards to the official from St. Albans. At this stage, though, there is no link between St. Albans and East London. On Sunday, Minister of Justice Ronald Lamola announced that 23 officials and 3 inmates had contracted COVID-19, adding that the 26 cases were detected at the female section of the facility. He said, The positive cases followed mass screenings that the Eastern Cape region embarked upon at the Medium Sea Female Centre after the first positive case was recorded on the 6th of April. It is believed that the first case at the prison emanated from an official who attended a funeral where she interacted with people from overseas. The official later tested positive for COVID-19. The second positive case was confirmed on the 8th of April after an official who sought out the service of a private laboratory received her results. Why did she have to go to a private laboratory? I'll let you work that one out. Mass screening and testing were rolled out at the facility, and by Tuesday the number of confirmed cases stood at 77. The National Institute for Communicable Diseases, or NICD, screened 268 inmates at the facility and tested 30 who showed symptoms of COVID-19 on the 8th and 9th of April, while 266 officials working at the prison were also tested. Nxumalo said, "As the number of infected people increases in correctional services, the containment and treatment pillar of the disaster management response strategy of the department has been activated. This is looking at the rapid identification of laboratory-confirmed cases, the isolation of those who test positive, and management of the pandemic within our centres. Only 2 out of 243 centres have reported positive cases of the virus thus far. Therefore, it remains critical that prevention measures remain enforced to keep other centres COVID-19 free." Valuable lessons have been learnt at East London, and this will influence our disaster response plan moving forward. However, it must be acknowledged that as the virus continues to spread in communities, correctional centres within the same localities will remain vulnerable. Nxumalo added that officials attending gatherings and movements from their residences to places of work are receiving attention in addition to screening. Mobile quarantine sites have been procured which assist with isolation cases, in addition to centres already identified and prepared for this purpose across all provinces. DCS also has a list of hospitals and healthcare centres where inmates can be transferred in cases where they require admissions. Nxumalo said appropriate safe escorts will be employed in order to limit the risk of officials and hospitals receiving inmates in need of care. Well, there's clearly a breakdown somewhere in the system if you're starting to have this cluster breaking out like it has in hospitals and in correctional centres. And as I've said so many times, it's not a matter of if, it's a matter of when this virus really takes hold in the townships. And it's going to be absolutely disastrous. All right, guys, please remember to subscribe to be kept informed. Ring the bell for the updates. Please like this video. Please share this video. And above all, please stay safe. Bye for now.